A third case of bird flu in humans has been reported. Michigan's Department of Health announced yesterday a human case of bird flu in a dairy worker. And unlike the two previously reported cases, this person has respiratory symptoms. According to the Michigan Health Department, the patient had direct exposure to an infected cow and was not wearing any protective equipment. Natasha Bagdasarian, chief medical executive with the Michigan Health Department, said, "This tells us that direct exposure to infected livestock poses a risk to humans." The CDC said in a statement that their labs tested a sample from the patient and confirmed it was the H5N1 bird flu strand.
This comes just days after the virus was found on an Iowa egg farm. Because of this, farmers have to kill over 4 million chickens on the farm. Over 92 million birds have been killed since the outbreak of bird flu in 2022. Joining us now to discuss is Professor of Infectious Diseases at Vanderbilt University Medical Center, Dr. William Schaffner. Thank you for being with us.
Good to be with you, Jessica.
So let's start off with, how scared should people be? How is this transmitted to humans? Do we have an effective vaccine?
Well, I don't think people should be scared. They should be interested. We're watching this very closely, we in infectious diseases and public health. This virus, this H5N1 bird virus, does not yet have the capacity to spread readily to people and among people. So these occasional infections do occur because of close association with infected animals, whether poultry, for example, or in this case, dairy cattle, but there's no spread to other people. So far, so good. And the blueprints for a vaccine are already available. That preliminary work has already been done in the event we need it. If this virus does accept the genetic capacity to suddenly spread from person to person, then that will be, as they say, a new ballgame.
It's been reported that the third individual to get this virus has been experiencing respiratory symptoms. What are some of the other things that people who do get H5N1 can expect to have happen?
Well, Amber, this is an influenza virus, and influenza viruses, of course, infect the respiratory tract, and you can get a sore throat, runny nose, and then if the virus gets down into your bronchial tubes, as it apparently did in this person mildly, you can get a cough, and as you know, influenza can make us feel very sick with high fever, aches and pains, and put us into the bed. Now, that is a very rare event, hasn't happened yet in the United States. These infections that we've seen now, the third, have been mild and have also had some conjunctivitis, that is a little pink eye. So perhaps the virus got on the worker's hands. He, I assume, was not wearing any professional protective equipment, so they probably touched their eye and thus infected the eye.
Doctor, I've done a lot of traveling recently, and I've noticed a lot of people around me getting sick, assuming it's the summer strain of COVID. Are we concerned with the prevalence of the virus in birds and the transmission to cattle, that there's potential here that humans are infected, but they're writing it off as this summer outbreak of COVID?
Well, so far, enhanced surveillance for these H5N1 bird flu strains in people has come up negative. We are continuing, and our location right here at Vanderbilt is part of this. We are continuing our surveillance of influenza-like illness throughout the summer. You know, we usually put that to sleep during the summer because influenza goes away, but we're continuing to do that in order to see if there are cases of bird flu that are occurring. And so far, across the country, we've seen none of that. You can get colds during the summer, and if you're traveling, you're exposed to a lot of other people, and I'm sure that that's what people are experiencing at the present time. You mentioned COVID. COVID has gone down also. It's not gone away. So if you're in a high-risk group and you develop respiratory symptoms, if you're older, have chronic underlying illnesses, if you're pregnant, if you're immune compromised, and you develop respiratory symptoms, get yourself tested for COVID just in case.
Agricultural and farm workers who might have a greater likelihood of being exposed to H5N1, what would be your advice to them? What are some of the measures they can take to prevent infection?
Well, the CDC, as well as local state located public health officials, agriculture, and the veterinary community are reaching out to dairy farmers, educating them about bird flu, doing surveillance among many of these herds, testing them to see if any of those cows are positive, and also making personal protective equipment available to dairy workers. Now, this is something new for this group of workers, and some are starting to adopt it. Others are still becoming acquainted with the possibility. And certainly those dairy farms where they've had infected herds, those workers are very much being encouraged to use masks, gloves, and protective suiting, these kind of Tyvek suits.
Is it understood that consuming contaminated or eggs or meat from chickens that have this H5N1, that could increase the possibility of transmission to humans? Is killing the chickens that are infected a precaution, or is it a necessity?
Well, killing the chickens is both a precaution and a necessity, because what we want to do is reduce the occurrence of the bird flu virus in the flocks so it doesn't perpetuate itself, so it doesn't keep spreading in that flock and to neighboring flocks. And now, this has been done for 20, 30 years around the world in bird flu outbreaks in poultry flocks, and has been found to be very effective, as well as other infection control activities in poultry farms. We're not killing dairy cows, but we are quarantining them and paying great attention to the workers who are exposed.
Do we have any indication, doctor, that this virus could potentially evolve to spreading through human-to-human contact?
Well, Amber, that's of course a consideration, because about every 15 to 20 years, the influenza virus newly creates itself. We get the capacity for this virus to be transmitted widely throughout the world, creating another pandemic. So we are watching very carefully around the world, 365 days of the year, testing influenza viruses to see whether they pick up these bird flu viruses, pick up the capacity to newly be able to spread from person to person. That's a concern, but let's take a deep breath. This has not happened yet, but we're watching that. Should that happen, our surveillance system is like a radar system out there giving us advance notice, and we could then advise the public and start creating a special pandemic bird flu vaccine if needed. And I say that the preliminary work to make that vaccine has already been done. We're ready to go and start manufacturing the vaccine if it's needed. Hasn't been needed yet. This virus still has not got the capacity to spread readily among people. So far, so good.
We appreciate you sharing your perspective. We're going to continue to follow this story. Thank you so much for joining us, Dr. Schaffner.
My pleasure. Thank you.